Hi, welcome to my YouTube channel. For those of you that are new here, here's a little bit about myself. So 10 years ago I was diagnosed with a condition called fibromyalgia, which means I have a chronic pain all over my body. It affects my memory and cognitive functioning, my speech, it affects my balance, so many things really. But it's a label that I have never believed in. I am convinced it can be significantly improved, if not reversed. So that's where I'm at with that part of my health. And then 6 years ago, I had chronic dental issues manifest, and that took me on a hell of a journey, really. And from that, I decided last year that I wanted to share that story, which I'm doing. It's near completion now. I've been working for probably 10 months now, I think, on a podcast called Find Me a Dentist, because my 6 year journey of going around the UK visiting so many dentists, it's been quite an eye-opener, to be honest. And I follow a lot of people overseas, especially in the States, who are on health and dental journeys, and also functional medicine doctors and biological dentists, and this whole world opened up to me. So I don't want to really say too much more about that because it will all be covered in the podcast. So where I'm at the moment, I've found my dentist, and I now need to try to get my body the best it can be in readiness for surgery, which will then help me with the recovery process, because most of my adult life I've ate really unhealthily. I haven't drunk enough, I haven't exercised enough. So yeah, my body's pretty compromised, but I believe anything's possible. And I'm 70-80% convinced that once all the issues in my mouth are resolved, that my rest of my body will follow. And with the brain functioning, is that mercury poisoning that's doing that? Who knows? We'll see. But I'll always be crazy. So I just wanted to pop on to share with you what I do for my morning supplement regime, to give you an insight into what I'm doing. And of course, everybody's story is different, and what works for me may not work for you. So it's about finding out what your needs are and finding the right products for you to use. So first of all, I have some amazing products from a company called Vital Organico, who are based in Ireland, and the company is run by a lady who has also gone through a dental journey and discovered all the things that work and don't work, and what is good for your body and what isn't. And her products are really clean, good quality products. So I'm going to share with you some of the ones that I use, and then I'll put a link to her website in the description of the video, so that you can look up and read about what these supplements do for you, because I can't remember. And there's also lots of other products on there that might be good for you, but they're not right for where I am at my stage of my journey. So the first thing is, because I get a bit overwhelmed with all of this, because I'm trying to do this and my nutrition and trying to go to bed earlier and trying to drink more and trying to move more, it all gets quite overwhelming. So with the supplements, I've got a box with lots of things in, and just to make it easier to stop myself feeling overwhelmed, I've written on the tops of the packet so I can very quickly see what that product is. So this one is a vitamin C, and I never know how to pronounce it, so hopefully I've said it right. Liposomol. I'm going to call it Lipo. So if I mention Lipo, that means it's a product in a bottle. It's in a liquid form. So if you feel you may have some imbalance in your gut, taking supplements in capsule form can just bypass your gut and you won't absorb all the goodness that you're supposed to be absorbing. So at this stage in my journey, I'm using lipo forms of supplements wherever I can. There's some things I can't, but the majority I am. So first of all, this is a lipo vitamin C from Vital Organico. So this one, you keep them in the fridge once you've opened it and give it a good shake. And I take 1 5ml spoon of this 3 times a day. So I'm just going to put that in some water. Okay, so that's the vitamin C. And then I have a lipo magnesium, again from Vital Organico. And I take 2 5ml of that a day, 1 in the morning and 1 in the evening. And then I've got a B complex lipo, which I take a 5ml, 1 in the morning, 1 at night. And a lipo COQ10. And with that one, again, I take 1 in the morning, 1 5ml in the morning and 1 5ml at night. Right, then I need a different spoon. Okay, so then I have, the vitamin C powder. So this is an ultra-fine powder. It's awesome. So I'm going to I take this 3 times a day. So it's 5ml 3 times a day. Then I've got a vitamin, a lipo D3K2. This is the most lush tasting thing ever, and I'm actually going to have it while I'm talking. So I don't put this into my glass of water with everything else because it tastes so lovely. I mean, the others taste lovely, but this is just So this is almost like how I would feel normally about eating a bar of chocolate, truly. It's so good, I have to lick the spoon out. And that's, it's a vanilla flavour apparently, but it tastes to me a bit like Baileys. And it tastes so creamy. So all of Vital Organico products, they've all got different flavours of like dragon fruit and different things. And so they're really lovely. So on the tablet side of things, I take a 1 capsule twice a day, the Vital Organico Tudka, and I think that is for your gallbladder, for your bile production, to help regulate that. But check on the website because I may have got that wrong, but I think that's what it is. And then I've got a Zinzino Balance Oil for my omegas because I had a blood test done which shows that I'm severely depleted in omega-3 and 6. So they're quite big actually. They're called soft gels. But I bought the oil in a bottle and I couldn't tolerate it because, well, I don't know the reason, but it felt like it was very acidic in my mouth and it was burning my mouth. Now I do get a lot of reflux and I've had esophagus issues, so it could be because of that. And constantly the inside of my mouth feels like it's it has no skin on it. It's really, really raw. So yeah, the balance oil liquid, I couldn't take that. So I thought, okay, well, I'll try the soft gels. So I bought a 6-month supply of those because it worked out a lot cheaper because they're really expensive. So that's my morning routine. And I say I do that, I repeat that again in the evening, except for the vitamin D and K. And then overnight I put on 2 patches, which are COQ10 and NAD patches, and they're both really good for getting oxygen to your cells overnight, and you keep those on for up to 8 hours. So it's quite, this is a whole new world to me, I've got to say, an expensive world, but necessary, because I need to make sure that I can recover from my dental surgery well. And I'm also nurturing my body, I suppose, for, well, it is abuse that I've put it through in my adult life with what I've eaten and drunk. And anyway, it's better late than never. And I'm feeling very fortunate and blessed that I've got such a good little support network around me, helping me, whether it's with products, knowledge, emotional support and friendship, I suppose. But ultimately, our health is our own responsibility. Nobody can do this for us. So it's all about, as I've sort of identified over many years, really, you've got to get your mindset in the right place. And it does help having people around you who can support you, particularly in those early days when it can be, well, it is overwhelming when you're trying to make a lot of changes, overlearn behaviours of a lifetime. That's not something that's very easy to do. So it's identifying the things that will support you in the process, and I feel I've got there with that, and it's really helping. I'm also doing some therapies as well. I'm doing chiropractor, massage and acupuncture, and a bit of somatics thrown in, and my counselling as well. So it feels like I'm being pressure washed. It's not for the faint-hearted, but if I can do it, honestly, anybody can. So it's just, as I say, identify your needs and don't be scared to ask to get your needs met. So I don't know what else I can say on that, really. I hope you've enjoyed that little insight into my morning, and I'll hop on again soon with the next updates. Lots of love, everybody. Bye.